Sleep apnea really has just surfaced over the last 5 years. It seems like it's been one of those conditions that have been underdiagnosed and undermanaged for many, many years. And a lot of symptoms that patients are experiencing that they're taking medication for very often can be linked back to sleep apnea. I don't have a sleep center, I don't do sleep studies, but what I'm able to do for patients is to make an oral appliance that help keep the airway open physically. CPAPs, which a lot of sleep physicians prescribe for patients that have sleep apnea, basically are machines that force air down a collapsed airway. Some patients do really well with a CPAP, and there's no problem with that. The people that I can help are those who do not tolerate the CPAP very well. Some people don't like to be restricted, don't like to have a hose on their nose all night long. And sometimes the hose doesn't stay on. They pull it off without knowing, and then the benefit of the CPAP is lost. What we found is that the compliance rate of people wearing the oral appliance is much greater than the ones that wear the CPAP. For successful therapy, I believe the oral sleep physicians or the sleep physicians say that the patient needs to wear or use the CPAP 4 nights a week for 6 hours each night. My question is what happens the other 3 nights of the week? What we found is that there's a much greater incidence of heart attacks early in the morning, very often because the heart was overstressed because the patient couldn't breathe. One of the sleep classes that I attended, they sent each one of the doctors home with a sleep monitor to the hotel room so they could see what we all experience at night. So one of the doctors knew that he had sleep apnea but left his sleep appliance out so we could see from what he was going through each night. The average oxygen concentration that should be in the blood should be about between 95 and 98%. This doctor spent 75% of the night below 80% perfusion. At one point when his apneic episode lasted for almost a minute, his heart rate went to 183 beats a minute. Because what happens is the heart wants to pump whatever oxygen is left in the blood around the circuit as fast as it can. So the heart gets really stressed at night when you can't breathe. Another thing that's tied to sleep apnea is gastric reflux. A lot of people take the little purple pill, the Nexium pill, when it very possibly could be that they just have sleep apnea. And once that's managed properly, they don't have to take medicine for gastric reflux. But so what I'm able to do is I'm able to relax the jaw muscles. When I relax the jaw muscles, the muscles around the airway also relaxes because the same nerves innervate those muscles. So when I can control what the jaw muscles are doing and the muscles of the head are doing, I also physically dilate the airway. Basically what the appliance does, it just physically holds the jaw forward and will open so that the airway doesn't collapse. Same principle we use in CPR. Tilt the head back, pull the chin forward, opens up the airway. So it's a physical way of holding the airway open so patients can breathe, not snore, and feel refreshed in the morning.